So my biggest piece of advice is to just, especially in the first few weeks of being on this medicine.
How can someone ensure they don't get stuck on Ozempic or Wegovy?
So one of the most important things with these medications is you want to think of them as a tool to help you with weight loss. They should not be the only way that you're losing weight. For people that start these medications and make a lot of changes in their lifestyle, for instance, they have lost a little bit of weight, they feel a little bit more energetic. Now they're able to do all of those exercises that they wanted to do before. They now get up early in the morning, they go to the gym. They are on that track of getting healthier, feeling better about themselves. They're more confident. You want to just keep that ball rolling. So you want to make sure you are putting in the work when it comes to exercise to help with the weight loss. Additionally, these medications may be associated with some muscle loss in addition to fat loss. So the idea is you want to make sure you are still building up muscle because muscle is critical for your metabolism. So when you're on these medications, you need to be doing some kind of activity to improve your muscle mass and strength. In addition to that, you should really be using these medications to help you make better dietary decisions. It's not just about eating less in one sitting or eating less often. It's really about choosing the right types of foods for your body. If you have the ability to think about what you're going to make for dinner, to meal prep for the week, to really put thought into the types of foods that you're eating, you can find healthier options. So you want to utilize the way this medication makes you feel in order to make better nutritional decisions.
Why do some people have problems when they come off Ozempic or Wegovy?
So, for people who have not made those lifestyle adjustments, they generally gain weight back very quickly. And it's because they've maybe lost some muscle mass and their actual metabolism is a little bit slower without the medicine. They also haven't made those behavioral changes. They're still going for the sweets, they're still going for the carbs, they're still maybe going for the junk food. They had been eating less of it, so they were losing weight, but they never made those changes in their overall nutrition. These are the patients where once you stop the medicine, those food cravings come back right away, the food noise comes back right away, and they rebound very quickly with gaining weight.
Okay, so it's not necessarily like a problem with their body that only the medication can fix, and then without it, they're back to that problem. It's that the medication gives them this window, more resources, more ability, and then something would need to change, like lifestyle wise, so they put their body in a better position to maintain whatever positive changes going forward.
Exactly. These medications are a great tool to help someone achieve these lifestyle modifications that they want to achieve. A lot of people, they don't like the feeling of coming home after a day of work and running for a bag of chips or a bag of cookies because they feel starving. People don't like to feel that way. They're not doing it because they want to. They're doing it because there are signals in their body telling them, you're starving, you need to eat something. The carbs are the easiest things to access right now. We're just going to eat. And so these medicines are going to allow you to walk in the door at the end of the day and say, okay, I'm not going to go to the pantry and grab that bag of chips. I'm going to wash these vegetables. I'm going to cook them. I'm going to make, XYZ for dinner. And it allows you to make those healthier choices. But if you don't listen to what the medicine is doing and you continue with your habits, it is not going to work in the long term.
Okay. If someone wants to make that habit change to rewire their brain and the signals their body's getting, is there like a number one place to start, like a first step that sets people up for success?
The main thing I tell my patients is they need to listen to their body. They cannot listen to their eyes. So, for years, decades most likely, they have been putting a certain amount of food on their plate. They have been eating at a certain time of day. It has just been a habit of theirs. They have been putting a certain amount of food on their plate compared to the person across from them, or ordering something off a menu compared to what someone else is getting. We're in this habit of, you go out to dinner, you get an appetizer, an entree, and a dessert. We're in that habit. When you start one of these medications, you need to forget everything your brain has learned, your eyes have learned over all of these years, and you need to really think about it individually. You can't go out to dinner and order what other people are ordering. It's not going to work for how your stomach is functioning, how you're digesting, how your hormones of appetite are working. You really need to take the time to get to know your body and what it should be eating, when it should be eating, how much it should be eating. And you can't do that if you're comparing to other people or comparing to your old habits. So my biggest piece of advice is to just, especially in the first few weeks of being on this medicine, like don't push yourself. Don't try to fit into your old habits or your old social life or anything like that. Like really take the time to say, okay, I went this many hours without eating and I was okay. I put this much food on my plate and that actually made me feel pretty sick. So next time I'm going to put a little bit less. And you really need to start to learn your new body before you try to almost get back into society, because it really is being intuitive with how hungry you are, how much you really can eat, when you feel full, things like that.
Okay. I'm going to ask this question because I know we're going to get questions about it. Can someone just stay on these drugs forever and not have to worry about the habit and lifestyle change and things like that?
So the simple answer I would say is yes, actually. And the reason I say that is because before these medications became so popular for weight loss, we had been using them to treat type 2 diabetes for years. And we've seen the effects of people being on these medicines for years. And honestly, they are very safe. Most people do not have significant side effects on them. I would say nausea is the biggest side effect, and if it's minimal, it usually goes away. And they have other health benefits. They can be very protective for the heart. They can be protective for the kidneys. They can reduce the risk of fatty liver. So there are a lot of additional health benefits. And we do see long term patients with type 2 diabetes, at least, are doing very well on these medicines long term. Um, However, I think most people can come to the conclusion that, okay, I have diabetes, I need to be on a medicine for a long time. They get that. They feel comfortable with that versus, okay, I'm overweight, I need to be on a medicine for the rest of my life. That's not really something people are willing to accept. And so I think that's why many people going on these medicines to treat obesity have in their mind, this is going to be a tool, it's going to help me get the scale down, and then I'm going to stop and keep these changes up for myself. So most people do not go into it intending to be on them forever. But if they needed to be on them for long term, I actually do think it's a very safe option.
Interesting. Now, is that because an alternative of dealing with type 2 diabetes has a lot of downsides and health effects? So preventing against dealing with those issues is amongst the two options. I can see how that's better. I mean, are there any downsides or negative effects? Not just uncomfortable side effects of taking it, but long term effects on the body.
Yeah. So, I mean, big picture, we don't know what these medicines will do for someone on them 20 years, 30 years. We don't have that kind of data. We have about a decade and a half or so of data saying that they're very safe. So if someone's on this for 40 years, what is it going to do? There's no way to know that yet. And you always have to walk into these things thinking, well, right now they could be telling me it's safe, but what if it's not in the future? And there's no way to go back from that. So I think that's why most people don't feel comfortable signing up for a drug for the rest of their life. We also do see, again, a decrease in muscle mass. I mean, certainly a decrease in fat, but again, that's going to come with a little decrease in muscle mass. And for some people, they don't do well with that. They become maybe a little bit too frail in a sense because they're not actively working to build up their muscle mass. There's also the idea of just cost and insurance coverage. I mean, it's terrible when I have patients where they were maybe doing really well on the medicine, but they changed jobs and their insurance plan changed and they can't get it anymore. And that's a devastating adjustment. Now they kind of need to go all the way back to where they were before. So, even I would say for patients starting this medicine, it's a good idea to think in your mind, I only want to use this for a short amount of time. So I'm going to work as hard as possible to keep up all of the changes. I'm going to eat well. I'm going to exercise. I'm going to reduce portions. Because if for some reason this medicine is not available to you 6 months from now, you've already implemented the lifestyle adjustments to keep that weight off anyway. So you will be in the best possible position.